Hello, I am Dr. Sudhir Mukherjee, an interventional cardiologist currently practicing in Kolkata. Today I'll be talking on coronary angiogram, few myths and few queries that you always have. A lot of patients comes to me with this query, so I'm making this short video clip so that you can understand it very easily. First of all, what is coronary angiogram? Coronary angiogram, if we say in a common language, then it's a test to look inside your coronary arteries whether you have a blockage inside the arteries or not. So it's a very simple way to look the coronary arteries from the inside. So if you have a blockage, you may need treatment to prevent fatal outcomes. If you don't have, then we are very happy. So this is a simple test. And the next question they always ask me whether it's a very painful or not. No, it's definitely not a painful. It's a very painless procedure. What we do for you to understand is that we took a small catheter through a puncture made through your right radial artery or your right femoral artery so that we can reach up to the heart and then put dye to look inside the coronary arteries. The whole procedure is painless and we do take utmost care so that you don't feel pain. In spite of that, many patients may feel little pain, but it is very negligible. So overall, it's actually a painless procedure. Sometimes we do not get enough access. In that situations, patients may experience little pain because of the spasm of the artery, but more than 99% of the cases, it is really a painless procedure. So how it is done? Well, I am not going into details of technical parts. You can refer to my previous video how the radial artery or right femoral artery angiogram is done. But for to understand in a simple way, I'm showing you this is your hand in the right side, right hand, and here is the right radial artery. So the right radial artery angiogram is now commonly performed in more than 90% of the cases. It's a very simple, very safe, and it's a daycare procedure. You can go home 2 to 4 hours after the procedure. So what we do is that we do anesthetize this part of your skin by lignocaine, and then we took a small needle to puncture inside your radial artery, and we took the catheter, and the procedure is being done usually within 5 minutes. When you are going to your right groin, the right femoral artery, and then you can see my past video how it is being done. Whatever the choice is, overall we always take anesthesia, local anesthesia, so that you don't feel pain. So it's not a painful procedure. Of course, it's a painless procedure. Lastly, many patients ask me what will be the results, what will be the complications. It's a very simple procedure. You may feel little pain and little swelling post procedure when there will be a compressive bandage to prevent bleeding. Apart from that, it's really a painless procedure. So don't worry about the pain thing. Go for coronary angiogram if it is really needed, because you have to look for the benefit that the coronary angiogram gives. It rules out or rules in the coronary artery disease. That is very important. If you're having a significant chest pain, if your ECG, echo or treadmill test show that you have a probability of coronary artery disease, you may need to go for this coronary angiogram to look inside your coronary arteries. It is absolute truth and nothing but the absolute truth. So don't worry about the coronary angiogram. I think this small video clip might help you with all your questions regarding coronary angiogram. Thank you very much.